So Clay here again, today with an 81-year-old female with sudden dyspnea and a normal ECG 3 weeks earlier. We'll also say for the sake of this presentation that she's also 4 days post-op for total hip replacement and since then has been bedridden in the hospital. So a patient that presents with sudden dyspnea, post-op, post-travel, anytime where she was in one position for a long period of time, you're thinking DVT and then possibly a pulmonary embolism leading to acute cor pulmonale. So in this patient, expecting the PE, you would want to look for characteristic ECG abnormalities, the first of which would be sinus tachycardia. So taking a look at the rate, as we've done in every video so far, and using our big box method, 300, 150, clearly over the 100 threshold for tachycardia. Then looking at the rhythm, you see a P wave before every QRS, even though you might also see some right atrial abnormalities in these P waves, you can see them before every QRS. So now, putting it all together, we have the sinus tachycardia that you would be looking for. You also see the characteristic S1, Q3, T3 in pulmonary emboli. So in this patient, you see the prominent S downward deflection in 1. You see the Q wave in 3. And the inverted T wave you can also appreciate in 3. So putting that all together, the S1, the Q3, and the T3 are all findings that you would most commonly see in a pulmonary emboli. Other associated findings that you may see, such as in V2, are a right bundle branch block, as well as in V6, you can see some slurring of the S wave. You can see some slurring in the S wave as well in 1. So putting it all together, what would you be looking for if you expected a pulmonary emboli? You would expect sinus tachycardia, as our patient here has. You would expect some sort of right ventricular pressure overload, some right atrial abnormalities. You would see inverted T waves in V1, V2, V3. You would see right axis deviation, which we see in this patient because we have a downward deflection in 1 and an upward inflection in AVF. You would see the S1, Q3, T3 pattern that we see in this patient. You might see a pseudo-infarct pattern in the inferior lead, so in 2, 3, and AVF, mild ST elevations that possibly could look sort of like an inferior infarct. You may also see supraventricular tachycardias, so you would expect to see the normal narrow QRS in those situations. And the ECG abnormalities are often transient, as in multiple EKGs ran on the same patient at different times may show a little bit different findings. So overall, looking for the sinus tachycardia, somebody acutely short of breath, if you had a pulse ox on them, a diminished pulse ox, all should point you into pulmonary emboli. So thank you for your time, and we'll see you again in our next video.